Following a dose of medication, a client develops inflamed mucous membranes and nasal discharge. What type of minor reaction is this client experiencing? A. Urticaria. B. Pruritus. C. Hives. D. Rhinitis. The answer is D. Rhinitis. Rhinitis may occur as a mild reaction following some types of medication administration. Rhinitis involves itchy or inflamed mucous membranes, particularly around the eyes, nose and mouth. The client may also develop swelling of the nasal passages or clear discharge. Mr. Y is receiving medication through a catheter that has been placed into the subarachnoid space of his spinal column. What route of medication administration is this called? A. Intrapleural. B. Intraosseous. C. Intrathecal. D. Intraperitoneal. The answer is C. Intrathecal. Medications administered through the intrathecal route are given through a catheter that has been placed into the subarachnoid space of the spinal column. These medications are given into cerebrospinal fluid, often for pain control. Placement of an intrathecal catheter is typically done by a trained physician or advanced practice nurse. Which of the following complications is associated with premature rupture of membranes in the pregnant client? A. Vaginal or cervical lacerations. B. Shoulder dystocia. C. Uterine rupture. D. Choriamnionitis. The answer is D. Choriamnionitis. Premature rupture of membranes occurs when the amniotic sac of a pregnant client has ruptured before the onset of labor. The client may be at increased risk of choriamnionitis, which occurs as inflammation of the membranes of the placenta. Infection may develop when bacteria sent into the uterus without the protection of the intact amniotic sac. A nurse is caring for a child whose parents live in a home with several other unrelated children and adults. Some of the people who live in the home have visited, and the nurse discovers that this group all shares finances and living conditions. What type of family is this most likely an example of? A. Blended family. B. Communal family. C. Foster family. D. Extended family. The answer is B. Communal family. A communal family is a group classified as a non-traditional family. In this situation, adults who are not related may live and work with other adults and their children all together in a household. The communal family may share expenses, food, and childcare in the same way as a traditional family. A nurse is educating a female client about progesterone. Which of the following information is appropriate to include in this teaching? A. Progesterone helps the body to maintain pregnancy. B. Progesterone stimulates the breasts to secrete milk. C. Progesterone causes uterine contractions during delivery. D. Progesterone causes development of masculine characteristics in women. The answer is A. Progesterone helps the body to maintain pregnancy. Progesterone is a hormone that is produced by the ovaries in women. Progesterone affects the tissue of the endometrium by developing the lining of the uterus in support of embryo implantation. In pregnant women, progesterone nourishes the uterine lining and limits uterine contractions to prevent miscarriage.